Even though orthopedic surgeons have been using arthroscopy or minimally invasive surgery in the shoulder and the knee for many years, hip arthroscopy or minimally invasive hip surgery has only come into its forte in the last 10 or 20 years. This allows us to do a lot of interesting work to help patients operating inside the hip with just small incisions, fast recovery, and fast return to activities. In the past, if you had a problem with a tear of your labrum or bony outgrowths around your hip, you often needed a large surgery with an incision of 12 to 18 inches long. You were hospitalized for multiple days afterwards. Now I can do the same surgery in an hour or two with 3 little poke holes about the size of my fingernail, have the patient go home that same day, and be back to sports after 3 or 4 months. The recovery for hip arthroscopy is pretty quick. Most patients will need crutches for about 4 weeks afterwards. We'll see them at about 2 weeks and take out the stitches. After that, the patients are walking around, are getting back to most of their regular activities. They can often start jogging with the help of the physical therapist at 2 or 3 months, start sport-specific training a month or so after that, and if all is going well, they could get back to their full activities after 4 months or so. I've been doing this for a few years. I especially trained in this during my fellowship. In my residency, I had a special interest in this kind of surgery, and my last 4 years I've been doing this surgery regularly. So although it's new to the area, it's not new to me. It's a surgery I enjoy doing, I find I have good results with, and I find the patients are really happy afterwards.